Hello everyone and welcome to this presentation by Kevin Wall, nurse practitioner, and Kevin's movies and short films in brief how to save a baby's life with skills performed by professionals. See the algorithms for any other details, and this will contain all you need to know to be able to save a baby's life during these circumstances. Please keep in mind and refer to the algorithms as we have also already secured the scene and activated 911. This is also two-person CPR, which uses a lesser compression rate of 15-2, where if it was just you by yourself, it would be 30-2. And we are also using an ambu bag to deliver the rescue breaths, and you would normally be doing that with some kind of protective equipment you could carry with you just to prevent infections. But if you don't have that and they're an infant, it's worth it to risk an infection or virus of any kind to save the baby's life. Thank you very much, and please enjoy the show. And I'm sure you will learn how to save a baby's life the most effective and correct way.
Begin when you're ready. Count out loud.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13.
Nope, you're gonna go to 15, right?
Tilt back. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Awesome. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And there, kiddo. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. I think we're done for that, right? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
When you're at 5, you can stop.
That's it.
Okay.
Start choking, start breathing.
All right. So, again, quick recap. An infant, right? So we recognize the cardiac arrest, right? We look, listen, feel, try to stimulate baby, are you okay? Are you okay? You spend less than 10 seconds, okay? 10 seconds or less, trying to find a brachial. If you are unable to, and the baby is not breathing, and they have no response, you have to assume that they are in cardiac arrest, okay? So you are going to do exactly what we did. We're going to start chest compressions, right? A ratio of when you're by yourself, what?
30-2.
When you're 30-2 by yourself, when you have a friend?
15-2.
15-2. We're going to push hard, push fast, allow for full chest recoil, right? We're going to compress 1/3 of the chest depth, 1.5 inches or 4 centimeters, okay? Again, the midnight thought is 1/3 of the chest depth, okay?